Good afternoon, everyone. My name is Chuchi Quevedo, and I'm a cancer patient of Dr. ROJoson. When I got my invitation for the May 22 pep talk, I was quite hesitant because I was afraid I might not be able to complete the sessions. But I was thinking, how can I turn down this brilliant doctor who is the mentor and idol of my brother and has nothing but goodness and kindness in his heart? And added to that, the topic was so timely, COVID-19. So I accepted it, and I'm so grateful that I did. Even if it was in conflict with my busy schedule, he made it very easy for us to catch up with his lectures. Admittedly, at 75 years old, I needed to sharpen my concentration to be able to absorb and remember the contents of the lectures. The OLETE exams were easy, but again, one has to perfect it to make sure that one understands it well. The OLETE also taught me a lot of patience and perseverance when taking it, because there were times when I would miss one number, but I had to go back and review it again and again. But when I get a perfect score in one sitting, what a wonderful feeling. Little did I know that I would be able to apply my kaalaman and kakayanan and karapatan sooner than I thought. I have this 90-year-old friend who went to see a doctor for regular checkup. She was referred to a surgeon because of umbilical hernia. The surgeon practices in a big popular hospital and told her to prepare for surgery. My friend has no relatives in Manila and was so dependent on me. I knew that she has had this ailment for many years already, but did not really complain of pain and just a little discomfort due to the bulging stomach. I knew little about hernia, so I read about it and thought it best to advise her to get a second opinion. The second doctor told her that considering her age and considering further that there is really no sign of strangulation, it is best to postpone the surgery when there is an emergency already. My friend was so happy about my advice to her. On another occasion, my niece called up last September crying and saying she didn't know what to do. Her 74-year-old mother was brought to the hospital because of a stroke. She recovered from the first stroke, but a second one happened again after 2 days, leaving her in a coma. My niece said that the doctors wanted to attach her to a machine, but she cannot decide on it. I was able to make her calm down. Then I advised her to tell the doctor on duty to allow her mother to just die naturally, and that it should not bother her conscience at all because her mom had a slim chance of survival. Much besides, their finances are so limited. After some time, my niece calmed down and did what I told her to do. These two experiences made me appreciate more the pep talks that we had been enjoying all these months through the tutelage of our dear Dr. ROJoson, and I really feel empowered now because of my added kaalaman, kakayahan, and karapatan. Thanks to you, Dr. ROJoson, I wish that more people would join your future pep talks. Thank you.